Good morning, everyone. We will discuss about the endometriosis treatment. So, endometriosis treatment mainly depends upon the complaints, age, site, severity, and desire of future fertility. So, for that, we will first, if we wanted to go with an expectant management, the symptoms should be minimal to mild, and the staging of the endometriosis should be minimal to mild, then without symptoms. But when the endometriosis is detected on the laparoscopy, and the follow when the patient is reliable for follow up, and if she develops any kind of a symptoms. Medical management, where we will include NSAIDs, COX-1 and COX-2 inhibitors, but most commonly used is COX-1 because COX-2 has a cardiovascular risk. So, in that, it includes ibuprofen 400 mg per orally 3 times per day, or we can use mefenamic acid 500 mg per orally for 3 times a day, 5 to 7 days, or we can go for the combined hormonal contraceptive when there is a mild to moderate endometriosis, and they are not trying to conceive, then only we should suggest for combined hormonal contraception. So it will, what is its mechanism of action? It will inhibit the gonadotropin releasing hormones, and it will reduces the menstrual blood flow. So when then it will, because of its progesterone action, it causes the decidualization of the endometriotic implants. So, or else we can give a combined oral. The combined oral contraceptive pills contains a 30 microgram of ethinyl estradiol plus 0.5 mg of levonorgestrel, or will go for 0.515 mg of desogestrel. So it is more effective cyclical regimen, where it causes atrophy to the endometriotic lesions, and it will induce the amenorrhea. Next, long-term effects by using combined hormonal contraceptive pill is thromboembolism. So whatever the treatment that we are suggesting, we should consider it for 6 to 12 months, when where they will have the relieving of pain and also some kind of symptoms. Progesterone pills includes Meprate 20 to 100 mg daily for 6 to 9 months, or we can use tablet norethindrone acetate for 5 to 20 mg daily, or we can go for the tablet dydrogesterone 30 mg 10 to 30 mg daily, or we can go for injection depot injection 150 mg once per 3 months. And the other treatment includes the dinogestrone, which is a fourth generation progesterone, where it includes where it comes under 19 not testosterone, synthetic progesterone. It is a highly selective progesterone receptor, and it is included as a drug of choice for the endometriosis, where we can suggest of giving a 2 mg daily for 6 to 9 months. GnR it is equally effective to GnRH leuprolide. Next comes to LNG. LNG, otherwise it is called as Mirena, where it contains 52 mg of the device. Full device it contains of 52 mg. Every day it releases around 20 microgram per day. It can be used for 5 years. So it will decrease the menstruation, it will relieve the pain, it will decreases the dysmenorrhea, it decreases the dyspareunia. Particularly, this is used in the rectovaginal septal endometriosis after the surgery. So, GnRH agonist, where it causes the pseudomenopause. So it will result in the hypoestrogenic environment. It causes atrophy to the endometrium. It decreases the COX-2 levels, where it includes some of the drugs like gostrelin 3.6 mg subcutaneously monthly we can give, or we can go for leuprolide acetate 3.75 mg IM monthly, or we can go for triptorelin 3.75 mg IM monthly, nafrelin 200 microgram intranasally twice a day. or we can go for GnRH antagonist, where it includes the where it will cause an immediate suppression of the GnRH that will lead to the decrease of the estrogen levels. So cetrorelix of 3 mg weekly we can give for 2 to 3 months. It leads to the regression of the endometrium around 60 percentage. So aromatase inhibitors are like anastrozole 2 mg per orally OD or letrozole 2.5 mg per orally OD we can give. So, and another drugs are like selective progesterone receptor modulators like ulipristal acetate or mifepristone or U486 10 to 25 mg per 3 to 6 months we can suggest. And other drugs are like androgens, dinosaurs we can advise, where it leads to the anti-gonadotropic effect and mild estrogenic anti-estrogenic effect, anti-progesterogenic action, where it reduces the sex hormone binding globulin and increases the serum testosterone levels. Other new treatment drugs include cabergoline of 0.5 mg twice weekly for 3 to 6 months. Thank you.